This presentation is a guide to show quick tips for the DD Form 2792 for EFMP. Make sure that you have the newest version dated August 2014. Sometimes a patient will bring their forms partially completed and then ask you to complete the medical portion. I find it quicker to complete the document on my computer where I can type as opposed to writing out the information. If you'd prefer to complete the document on your computer, simply keep the documentation that the patients have given you, open a new document, and ensure that the basic identification information is filled out for the patient name, patient sponsor, and social security number. Generally, this information will auto-populate on the remaining pages. And turn both copies into your EFMP case coordinator, and the rest can be merged by them. If you prefer to complete your documentation on your computer, I recommend that you complete a template for yourself. Simply fill out your provider name and contact information and save. Use this template for future documentation purposes, and remember to save as a new file with each new patient. If this is an EFMP update, then the patient will likely have prior documentation. The LaunchTool EFMP office is currently trying to upload the previous documentation into the AltaNote under the HAIMS application, HAIMS. You may also contact your EFMP case coordinator and ask them for a printout, referred to as PERNET, P-E-R-N-E-T. The PERNET documentation will include all prior diagnoses. You must address all diagnoses on your updated EFMP form. You may remove a diagnosis, but it must be stated on the updated documentation. The PERNET information can be helpful in your update to keep the information consistent if there's been no changes. The new EFMP file from August 2014 can be signed electronically, which allows us to send these documents electronically as long as it's encrypted. Note that each section that has medical documentation must be signed by the completed medical provider. Once you've completed the diagnosis, the ICD-10 code, medications, and the number of visits that were required for the diagnosis, give a brief synopsis of the primary diagnosis and treatment plan in this box. If there are AltaNotes that are particularly helpful, you are encouraged to reference those in this box as well. If you have questions about how to complete this form, please reference other videos or call your local EFMP case coordinator for further guidance. You may obtain your PERNET documentation from your EFMP case coordinator.